So the second aspect of hitting your marks is really knowing how long each visit and each visit segment should take and being kind of conscious of that during the visit. So it's easy to kind of sit down with a patient who's got a lot going on, start asking them genuinely what's going on with them, taking a good history, and finding that you've already spent over half your visit or more talking with the patient and not realizing it. Most of the time, when I see a patient for a physical, depending on the patient, I can predict pretty well about how long the initial history and sit down portion should take. For most patients, it's actually pretty short, 5 minutes, maybe 6, 7 minutes. Of course, new patients take a little bit longer to get to know, but I'm always thinking about when am I going to get them up on the table and move through the next segment. I've got a pretty standard physical exam for physicals, for example, and I tend to know how long it should take before I'm back sitting down with the patient and really diving into some of the work that we're doing around whatever their health goals are or whatever else is going on with the physical. Similarly, for some of those common visits, like when someone comes in for a cold, a cough, headache, musculoskeletal injury, depression, anxiety, insomnia, those kinds of things that whatever you see regularly in your practice, it's helpful to know about how long that should take on average for patients and about how much time you should be spending talking with the patient, when you should be getting up, moving to the physical, and then sitting back down and investing in that last part of the visit. Starting to be aware of that and having that internal or even having an external clock keep you on track is really important and takes away a lot of the anxiety and kind of nebulous aspect, gray areas around staying on time. Thirdly, you along those lines, when you've kind of gone outside that expectation and you feel like, uh-oh, this visit has gone off track or it's just going to a place where it needs to go, but it's taken a little bit longer than expected, you've got to learn to bring it back or to improvise. So, for example, if you start asking a patient about back pain, you're kind of taking your back pain history, you think you should be moving on to the exam, and all of a sudden they mention, well, they just had a child die or some other big trauma that really requires attention. You're going to have to improvise a bit there. But at the same time, you should be thinking about what sacrifices you might be making in other parts of the visit. So maybe you won't get to do as thorough of a back exam if you're not too worried about anything serious going on, if you think it really is due to the other things going on in life. Or maybe you won't take as much time educating the patient and you'll give them something to read instead after the visit and ask them just to check back with you if they have other questions. So being able to improvise a little bit and being aware where you are in the visit and if you've gone out makes a huge difference.